2021 to 22 or 22 to 23 saal laga Kayakalp awardees ka nimide Health and Family Welfare Directorate laga Conference Hall Kohima de felicitation program rakhishe. Idu even de Nagaland Health Minister P. Paiwang Konyak special guest takishe. Minister pa program de Kayakalp Opor khota kurigina kushiki to public hospitals kan de exemplary performance kan recognize kuribole aim ase. Tai kushiki manukan doctors or nurses kan ge second god or angels nichina sai. Kayakalp program do hospitals kan de sapa bhal quality care or infection control kuribole practice kan de focus create. Nagaland do program 2015 to 16 de anisha or community ge health unit activities kan de involve kuribole encourage create. 163 health units awards paishe agide Minister Paiwang Konyak pra Drugs Control Administration or Nagaland Drugs Laboratory laga nutun administrative office integrate kudishe.
It is truly a path-breaking initiative, one that has transformed the entire landscape of this country. And I say so, I am not an organized, hygienic and systematic person. I am quite a random person. So, the concluding remarks also, and the look at Twensan Hospital, it's very encouraging to know that people are getting wise and beginning to understand the value of coming forward to preserve and to promote what you have to make it even better. The example of Twensan is one that encourages me greatly, and I want to tell the awardees how important they are, not only for the performance they have brought out, not only for the benefit that they have brought to their communities where they are performing, but even as examples for others to see and feel good and be encouraged. You know, departments and ministries of both the state and the central government can only go as far and as high as the people who work in their domains. And I have been in a ministry and I have experienced the pressure and tension that comes when the standing committees of the parliament call for the ministries to stand and appear before them to give evidence of their performance.
In a special way, I thank Almighty God for giving me the opportunity, for giving me the privilege to be amongst the so-called the second God people, the angels and the apostles. Because many of you who are doctors are not aware, but the citizens considers you, the people considers you as the second God, the apostles and the angels. And it is a privilege on my part to be associated with people like you. As I've said, today it is a great opportunity, and the Principal Director had already mentioned that today we have 3 consecutive programs, and it is my first formal visit to the Directorate of Health and Family Welfare. And in the first hour, we have inaugurated the Drug Control Administration, COM Laboratory, and now we are in the second program. And after this program, we will be having a review meeting of the department, and I'm sure that all the directors are well prepared with if you want to provide with PowerPoint presentation, or if you want to provide us with a draft of the presentation. I think that is, I hope you're all prepared, and that is the important discussion that we will be following after this program. It is an honor for me to be a part of this auspicious occasion where one of the most important initiatives under the National Health Mission launched by the Government of India, Kayakalp, a clean hospital initiative award has been accorded to public hospitals to incentivize and recognize exemplary performance. And I thank the CMO, the MS, the citizens of Tuensang district for proving your capacity, your ability of providing the best clean hospital and also the services towards the people. Kayakalp program envisages a promotion of cleanliness and hygiene, enhancement of quality of care and infection control practices as a critical part in all hospitals. With the introduction of this initiative in the state in the year 2015 and 2016, one of the main benefits that the medical fraternity have seen is boosting the involvement of the community in the activities of the health units in the form of timely social work and contribution in cash and kind towards improvement and upkeep of the health facilities. Over the years, the success of this initiative has hinged on the improvement of public health services in the terms of cleanliness of public hospitals, infection prevention control, and thus created demand generation towards the public health institution from the beneficiaries and also enhanced the commitment of the service providers. I note all the team members of the 163 health units which have been felicitated today for their commendable job and appeal not only to them but also all under the umbrella of health sector to continue working relentlessly towards the betterment of the public health services. You will remember that in the last month, the Honorable President of India had inaugurated the Ayushman Baba, and also the Honorable Governor had inaugurated in the presence of the Honorable Chief Minister of Nagaland, Ayushman Baba in the state. It envisages cleanliness and also better health facilities. I have been reminding whenever I have visited the district hospitals on 2 occasions in Mon as well as in Dimapur about the Ayushman facilities and also the Chief Minister Health Insurance facilities. Now you will know that people, even in the far-flung areas, even in the far corners of the state, people have money in the form of Ayushman card and also in the form of Chief Minister Health Insurance cards. So they would prefer for the best facilities of health for the treatment. Therefore, if we are not very careful, if the state are not very careful, if the department is not very cautious in handling the health care of the citizens, that there will be a time where the people will only go to the private clinic for health facilities because they have the money in their hand in the form of cards, and we will be left jobless. And that will be a moment where in the eye of the God and in the eye of the people, we will be cursed. Therefore, I appeal to all the health officials, the doctors, the staffs, the nurses, that we perform better and better every